Guys, as promised as before, I was going to show you the books that I used for the MRCS. Sorry, excuse the cough. MRCS Part A and Part B. So the first book is the MRCS Part A Revision Notes, Essential Revision Notes, Book 1. It's are edited by Claire Richard Chambers as well as Catherine Parchment Smith. That's one volume, and there's also Book 2, which this is it here. Those are two books that I think are essential for Part A. This book I use for some of the main topics like peripheral vascular disease, acute abdomen, as well as acute cholecystitis, hernias. I like how this book covered it. It was in detail. Once you read it from this book, you don't need to read it again, unless because if you're doing it in practice, it should come just really like second nature, right? Use those books for anatomy as well as physiology, because it has applied physiology in the book. I also use the surgical principles book. The Bailey and Love was for the surgical principles. The next book that I found was really helpful for the anatomy station was this book. It's Clinical Anatomy, Applied Anatomy for Students and Junior Doctors. It's like by the godfather of anatomy, Harold Ellis, and Vishy Mahaden Devan, which I'm not really too certain who that is, but I know Harold Ellis. He has a lot of the videos online for anatomy. This book is concise, has everything you need to know for the MRCS. So you read this and read the common topics. Don't go and read like for want of lymphatic vascular or lymphatic drainage. Read things like that are common, like sorry, the anatomy of the lower limb, anatomy of the upper limb, limbs basically, brain, neck, thyroid, parathyroid, know embryology to some extent. That's pretty helpful especially when it comes to the thyroid. It's very helpful. And pharyngeal arches and pharyngeal pouches, branchial pouches. That's a skimming the surface for the anatomy. Next book I found was really helpful was this, The Netters. Medical students use it all the time. It's helpful for both Part A and for Part B. Anatomy was also helpful. This book, The Clinically Oriented, this is an old volume. There's a newer version, but anatomy doesn't exactly change over time that much. I mean, it's anatomy. So once you use this book, and I don't recommend reading The Clinically Oriented from cover to cover, because you're just going to waste time, and half the anatomy is not going to come. Not half, 3/4 anatomy from the book is not going to come. What's essential, especially for Part B, is origin and insertion of muscles. The Clinically Oriented has the details, especially in the tables that they have throughout the anatomy book, that is essential for the OSCE. It allows you to say where what is attached to where. In my exam, a lot of questions were asked about the origin and insertion of muscles, especially the abdominal wall, which for some reason in the exam that just went scrambling, because I found that very challenging. The origin and insertion of the abdominal muscles, for some reason, always just gave me trouble. No matter how many times I read it over and over and over again, it was just challenging. I read a few topics from this book. This is Essential Surgery by George Burkick, Clive Quick, and Joanna Reed. Let me show it again. I like this book. It has a lot of pictures. I read appendicitis from this book as well too. It's good. It's a good book. Concise. Just remember that MRCS is about content of your, or the how can I put it? It's about the level of your knowledge, but it's also about getting it to the point where it's concise and you're able to recognize small or tiny differences between MCQs in the Part A, and you're able to identify what goes where, and you'll be able to apply your knowledge when you're asked questions in the examination. So for instance, there was a time in the exam they asked me things like, What are the complications of a chest tube insertion? You have to know what the anatomy. This is basic medical school stuff where they ask you, well, it can damage the pleura, it can damage, depending on if it's placed on the left side, it can damage the apex of the heart. It can also damage if it's placed on the, depending on the level you place it. If you place it incorrectly, it can damage the long thoracic nerve, it can damage the diaphragm, it can damage the liver. It's all about if it's placed incorrectly or correctly, it can still do a lot of damage in the areas. You have to know where the neurovascular bundle is located, things like that. Those are very common things that are asked in examination settings. Okay, so I've told you about those books for part A and B. These two books were recommended to me by someone. This is How to Pass the MRCS OSCE. I didn't like these books. Weren't very helpful. Reason why I would say they weren't helpful. You read them and they're in point form. Unless your brain works in point form, it's not very helpful. Me personally, I have to read and get a background knowledge of the book, of the topic. And some topics, even though you have read them before, they can still come across as though they're new. Even though you're using them on a day-to-day basis, there are things you've read maybe last week that when you read them over, you realize you missed important stuff. And finally, this book, the Browse Introduction to Symptoms and Signs of Surgical Disease, and there's also a Browse book here, the Investigation and Management of Surgical Disease. These two books are very helpful, especially when it comes to colon cancer. If you want a quick review of colon cancer, these books. Burns, pretty helpful from this one, especially the Investigation and Management of Surgical Disease. Haven't seen it in a lot of stores recently, but I think it's still published. So those are the books I use, along with the question banks. To me, the question banks are about 50% of your preparation. Then another 25% is how you present. Another 25% is basically your ability to keep your nerve in the examination and not panic if you don't know the answer. This is for the OSCE. For the part A, the question bank is about 80%. 20% is your knowledge, but the question bank helps you recap what knowledge you have. So you still have to read. My advice for the part A is to do as many question banks as possible. It's expensive. This whole process is a very expensive process, but it's best if you do it once. Unfortunately for part A, I did part A in 2014 and I failed it in 2014. That's when I just finished medical school and did it back over last year, and I was able to pass, and that's because I was in a different mindset and I was able to do as much questions as possible. So I came to part B now, and what I did was a friend of mine, a fellow doctor, he's in the UK right now, he advised me to do as many questions as possible for the part B. I did that as well as I practice. So when I say practice, I don't just mean practice examinations. You have to practice speaking. So in the examination, they expect you to be articulate, because when you are called on the phone, there's even a station in the exam that you have to call and relay information to your senior and ask them while they're in theater or in clinic if they should come to the ward for an emergency. You have to be articulate. If they can't understand what you're saying, that's a big problem. That's where mistakes come, and that's where lives are lost. So you have to read through this entire case in less than about 9 minutes, and then you have to present. And there are things we can miss, little nitty-gritty stuff. And then they even ask you if the patient was in distress, and you have to make sure you have picked that up in your notes, unless, for want of a better expression, I had a consultant when I was in medical school to say slaughtered. So ensure that you read the cases in the examination very carefully. Once you read them, you may know the answers. Take about 20 seconds to process, and then just get your thoughts into Get your thoughts very organized, and just speak slowly. For those of us who are not from England or from and some people might not even have English as their first language, we speak English very fast. I speak English very fast. I'm from the Caribbean, so I tend to speak English very fast. So for if English isn't your first language and you speak English very fast, slow down. Okay? More tips coming soon. Stay tuned.